So currently my back pain is mainly focused in my lower right side, just above my hip area. I feel a lot of discomfort when I rise up from sitting at my desk too long or sitting in a car too long. Kind of bend and kind of come up a little bit, and I kind of feel a sharp pain, and it'll kind of go down my leg a little bit, affecting the way I can pick things up and move around. So on a scale of 1 to 10, I'd say my back pain's probably an 8, maybe a 9. I've actually been to a back doctor, multiple massage therapist sessions. I had a discectomy surgery on my lower back to help relieve some of the sciatica pain. Sometimes it gets a little better, but then it always ends up coming right back. I always feel like I'm having to stand up, stretch, move away from my desk, come back. And then in the evening times, playing with the kids, just spending that family time. Sometimes it's just my back's bothering me and it's hard to move around and have that extra time with them in the evenings.
Hey, I'm Ian Hart with Back Pain Relief4Life, and I'm here with Richard. And Richard's gonna be doing a case study with me. He's somebody that has had back pain for over 10 years, and he doesn't know what Back Pain Relief4Life is like, so I'm gonna take him through the back program, and then we're gonna see how he feels afterwards. First thing we're gonna do is get down into the starting position, but since you have back pain, we wanna make sure we're getting up and down correctly, because as you mentioned in the pre-interview, the way you moved causes you to actually cause the pain, and this is common. So what you're gonna do is you can stand by the side of the mat, you're just gonna get down on one knee, and you can follow me. You're gonna put your hand down to the side, and then just shift down to your butt. Yep, and now use your elbows so you don't put pressure on your back, and then lay back and put the ball right at your head, and tell me how that feels on your neck. If through the movements, if the ball feels like it's too high, let me know, or if it's too low, we'll pump it up. All right, so now this is the starting position that you're in right now. Open up your hands a little bit wider. You're gonna put pressure down with your hands to engage your abs while we do these movements. Okay, and so I'll correct you. You don't necessarily want to put the stress here, but the more you activate the abs, the better the results will be from the program. So the first movement we're going to do is what's called a knee pull. And you're going to bring your left knee into your chest, slow and controlled, until you tuck your pelvis under and pull the knee in a little further until you feel stretching your lower back. Keep going. Feel the stretching your lower back? Mm-hmm. Okay, now you're gonna extend the leg out without touching the ground, so bring it all the way out, close to the ground. Keep going, right there, and now repeat. We're gonna do about 8 to 10 reps, we'll see. Keep that knee straight, 2, and each time, try to pull back a little bit further, and right here, I want you to keep tight and squeeze as you pull in. You see how you're a little bit shaky with that movement? That's your nervous system. That disconnection is a little bit of lack of connection there. And that's where your pain, a lot of it's coming from. Good. Squeeze the abs as you do it. There we go. Good. Try to keep that knee as straight as possible. So as it tries to pop out, try to keep it straight. There we go. Do you feel the difference there? Mm-hmm. Good. Do one more just like that. Better. Good. Extend. And now switch. You're gonna do the same thing on the other side. Where did you feel that the most when you did it?
Right here in this lower part of my back.
In that area you have the issue. Mm-hmm. Perfect. Try to keep that pelvis straight. Put pressure down with the hands. Tighten the abs. Good. Breathe. Nice. That was perfect. You're getting more mobility. Mm-hmm. Yep.
The less shaky I'm feeling too.
Good. Yep. So now we're getting a stronger connection from your nervous system to these muscles. And a lot of times back pain is a disconnect between the mind and the muscles. Get both hands at the side.
I can feel my hip bone shifting.
Yep. Good.
That tingled.
So one thing about this, never move into pain, but you might feel like...
Yeah, it wasn't painful. Yeah. It was just a little tingle.
Like you haven't felt that area in a long time.
Mm-hmm.
Yeah. Probably getting more blood flow and oxygen there. Good. 3 more. Good. Does this hip feel locked up a little bit more? Mm-hmm. Yep. Push open. Just go control. You feeling any pain with it?
It just made my calf muscle tighten up.
Did it?
Yeah.
Okay.
It's like...
Oh, it locked up.
Yeah.
Locked. Yeah, so if it locks, just relax it for a second. Well, that's a good sign because now we're activating nerves that are going all the way down. So, yeah. Is it good now?
Mm-hmm.
Good, too. Good. All right, so now we're going to do the 7th exercise, which is targeting your obliques. So you're going to put your right hand touching your ear, your left arm out to the side, and actually you can bring it down here, palm down, and keep your elbow down. Very important to do this correctly. You're going to bring your right elbow to meet your left knee. Other one. So bring this up, bring this up to you, right there. Good, and then just drop back down and repeat. And squeeze your obliques, which is right there too. Good. Yep. Think about right there. Good. 3. Even on the way down, try to keep it active. 4. Good. Right back up. 5. Breathe. Good. All right, so we just finished up Back Pain Relief for Life with Richard. First time he's ever been taken through it. Richard, what did you think?
It was amazing. I could definitely tell the difference from the beginning of even just first exercise. And so I can almost feel like I'm standing straighter, kind of getting that blood flow, and it was kind of activating everything in my neuro system as well. Feels like I'm kind of a little spacey a little bit.
Okay. We're getting more blood flow, nutrients, and oxygen. We're actually reaching up into the brain and unlocking the key to the back pain because it's all connected to your muscles. Scale of 1 to 10 now, how is your back pain?
Probably a 2. The opening of the hips really brought a lot of relief out of my back pain. I don't ever do those movements in everyday life. Sitting down, standing up doesn't require you to open that hip up. The really aha for me was to know that opening up these hips can help relieve a lot of that pain in that back for me.
Richard, first time in 1.5 hour doing Back Pain Relief for Life, got relief, went from a 5.5 to 6 in pain level down to a 2 in just a half hour. And remember, this is just one session. Now you have the tools and the key to actually do this for the rest of your life. We're going to give you a DVD. And you can also access the online program as well. There's somebody out there who's like you, business owner, who has this pain, who's skeptical. What would you say to that person?
I would definitely say remove the skepticism, give it a try, and the worst thing you got to lose is 30 minutes.
Perfect. Awesome.